Well, my friends, this is another case of this 38 years aged man with the shape of a restaurant has been suffering from dyspepsia, has been suffering from heartburn, acidity and amoebiasis recently since childhood. ছোটোর থেকে আমাশার ভাব চলছে তোমার, এই জন্যে খুব কষ্ট পাচ্ছে। আমাদের এখানকার লোকাল ছেলে কিন্তু মুম্বাইতে থাকে চাকরি সূত্রে, একটা চাইনিজ হোটেলের শেফ, খাবার তৈরি করে। So the totality of the case go in favor of Mercurius. So dyspepsia means not lycopodium, not Knox bomb, not pulsatilla, because totality is our capital. Totality is our capital.
Priority.
Though he has been suffering from dyspepsia, but there is profuse salivation, profuse thirst, profuse perspiration. These three symptoms, profuse salivation at night during sleeping, thirst plus plus, sweat plus plus, discharges are a little bit offensive, indicates which medicine?
Mercury.
Shabbas. So Mercurius is the choice of medicine. The junior doctor who has taken the case, Dr. Videsh, already mentioned Mercurius. Thank you. So Mercurius is the choice of medicine, though the patient has been suffering from dyspepsia, gastrointestinal disorder. Deep dekhao. So the tongue is Mercurius, salivated, tremor, and a large tongue. So also tongue symptoms also cover Mercurius. So this is only possible by collection of the totality, and not possible by a single medicine given without totality, only by one or two few symptoms, or by polypharmacy, mixing by many medicines at a time. Now the term totality ordinarily means the sum totality of all the symptoms. But in homeopathy, it bears a special meaning so far as its practical utility is concerned. It does not mean the numerical aggregate of symptoms, but a picture or portrait derived from a logical combination of all the subjective and objective symptoms. Thus, it is now evident that the mathematical aggregate of the 50 symptoms is not the symptom totality in homeopathic practice. You have to remember. So totality means the symptoms of the disease alone, ignoring the individuality of the patient, is not to considered by the homeopaths. So please remember about the totality. Totality is only possible by proper case taking. A thorough case taking of the first grade is primarily essential for tracing such a picture of a patient. We must be cautious that nothing is left out in the case taking, because if a valuable symptom is omitted during case taking, we cannot obtain a significant picture of the patient. The next point is correct analysis. The correct analysis of the symptom, this is termed as anamnesis of homeopathy. This includes the causative factors, exciting causes, and the maintaining causes, and the miasmatic dyscrasia is to be discovered, which is known as the fundamental causes, including the past history of the patient, personal history of the patient, family history of the patient, I mean the hereditary factors, and inference on basis of these, as also isolation of the common and characteristic symptoms. Well, my friends, next come the evaluation of symptoms and their arrangement according to priority. The picture of symptom totality will be reflected to a homeopath as per his own capacity of evaluation of symptoms. This evaluation is the only way of obtaining the real picture of a patient. It may have even so happen that only 5 or 7 out of 20 or 25 symptoms which have been collected will constitute the significant picture of the disease and patient. So the etiology, the constitutional symptom, the concomitant symptoms, rare and striking symptoms occupy the highest priority in the case taking. So the evaluation of symptoms only help in perceiving both the disease picture and the drug picture, my friends. So please remember about the totality, evaluations, anamnesis of homeopathy. Then only you will be able to select a correct medicine. Otherwise not, my friends.